When you think of a massage, what comes to mind? Probably relaxation, a spa day, maybe a little luxury, right? But what if your doctor actually prescribed you a massage and your insurance covered it as a core medical treatment? Well, that's exactly what we're diving into today. Germany's really fascinating and super structured approach to back pain. So that gets us to the big question. Can a massage actually be medicine? I mean, in a lot of places, the answer is kind of fuzzy. It's often tossed into the alternative or complementary care bucket. But in Germany, well, the answer is a whole lot clearer.
And yeah, that answer is a very firm, very structured yes. See, the German healthcare system has built this whole comprehensive framework that plugs specific types of manual therapy right into mainstream medicine. We're not talking about a suggestion here, we're talking about a prescription. And the term for this is absolutely key. It's called manual therapy. Now, this is not just a fancy word for massage. It refers to a very specific category of therapies that are prescribed, backed by evidence, and performed by highly trained pros as part of a clinical treatment plan.
And this is where this system draws a super sharp line in the sand. A wellness massage, that's for relaxation, and you're paying for it yourself. But prescribed manual therapy, that's a completely different ballgame. The goal is a specific clinical outcome. It's done by a certified physiotherapist, and you can only get it with a doctor's prescription. The two could not be more different.
Okay, so who is this highly structured therapy actually for, and what does it treat? Well, the German system is incredibly specific about this, especially when it comes to tackling chronic pain in its older population.
The target demographic are the Senioria, and that's the respectful German term for older adults or senior citizens. Right away, this focus shows you a real commitment to quality of life in the later years. And the condition they're laser focused on is Rückenschmerzen, specifically that nagging, chronic low back pain that can be so debilitating and is just so common among seniors. By defining both the patient and the problem this clearly, the treatment can be incredibly targeted. All right, so this is where it gets really cool, the science behind it all. How do they know it's actually working? Because this isn't just based on someone saying they feel better. The effectiveness of manual therapy is measured by real, concrete, physiological changes happening inside the body.
Yeah, this whole approach is rooted in solid evidence. The goal isn't just relief, it's to see measurable biological effects that prove the therapy is having a real clinical impact on the body's pain and stress systems.
And this shows you exactly what they're looking for. Therapists are tracking two key things. First, a decrease in sympathetic nervous system activity. The easiest way to think about this is like turning down the volume on the body's fight-or-flight response, which is often stuck on high with chronic pain. Second, they're looking for lower levels of inflammatory biomarkers. So, in short, they are scientifically measuring less stress and less inflammation in the body. It's pretty amazing.
Okay, so we know who it's for, and we know how they measure if it's working. But what does it actually look like in practice? This brings us to the practitioner's method, which is all about the skill and precision of these German physiotherapists. The first thing you need to know is that this is not a general all-over back rub, not even close. It is a highly targeted and precise physical intervention. The therapists are focusing on very specific anatomical structures that are known culprits for causing chronic back pain and postural issues. And there's a methodical process to it. First, they target the deep lumbar fascia. That's the tough connective tissue in the lower back. Second, they work on releasing tension in the iliopsoas, which is a deep hip flexor muscle that's very often linked to back pain. Third, the techniques are all designed to improve tissue perfusion, basically getting better blood flow to those affected areas. And finally, and this part is so important, it's not a standalone treatment. That fourth step, integration, often involves something called Krankengymnastik, which is the German term for physical therapy. Manual therapy is frequently prescribed right alongside it, creating this powerful one-two punch that combines passive hands-on work with active movement and exercise from the patient. So why go to all this trouble? I mean, why create such a detailed, integrated system? Well, when you zoom out from the individual patient, you start to see that this medical approach is tied to a much bigger public health philosophy, a national goal, really. And this quote just says it all perfectly. The goal is to keep Germany's senior citizens robustly active. It's a proactive strategy to maintain their mobility and independence, all while trying to minimize how much they rely on pain medications, which, as we know, can have some serious side effects. So what are the tangible results they're shooting for? It's not just about having less pain. It's about improved functional mobility, the ability to move through your daily life with ease. It's about better posture and more stable walking, which is huge for reducing the risk of falls. And of course, it's about a direct reduction in the need for painkillers. You add all that up, and what do you get? A more active, healthier, and more independent senior population.
So as we wrap this up, it leaves us with a really powerful question to think about. By treating a specific kind of hands-on therapy not as a luxury, but as a precise, evidence-based medical tool, Germany is showing us a different way to manage chronic pain. So what can other healthcare systems learn from this approach, from taking manual therapy this seriously? It's definitely some food for thought. Thanks for tuning in.